China by Rachel, Kelsey, and Bailey. Population and stage of DTM. The population of China is 1,379,302,771. The population growth in China is 0.51%. The median age of the population in China is 37 years. China has already entered stage 4, if not transitioning into it. The number of births per year is 17.8 million. The amount of deaths per 1,000 inhabitants is 7.11. And the life expectancy of birth is 75.7 years. Sex ratio. After social unrest and famine in the 1950s, the Chinese population developed rapidly over the following decades. To counteract this explosion in population, the one-child policy was introduced to China in 1979. On October 29, 2015, the existing law was changed to a two-child policy. Maternal Maternal mortality rate. As a result of the two-child policy, the absolute number of births in China amounted to 17.86 million in 2016, which grew by 1.31 million births compared to the previous year. In contrast, the mortality rate in China dropped slightly in 2015, reaching a ratio of about 7 deaths per 1,000 inhabitants. Population pyramid. The gender distribution in China's population has traditionally been lopsided towards the male gender. Still, the total population gender ratio dropped significantly from 107.56 males per 100 females in 1953 to about 105 males per 100 females in 2015. Dependency ratio. I messed up. Dependency ratio. Total dependency ratio is 37.7. Youth dependency ratio is 24.3. The elderly dependency ratio is 13.3, and the potential support ratio is 7.5. The ratio of number of young people to the number of people working age ranged from 0.56 to 0.72. This ratio, known as the youth dependency ratio, was much higher than the old age dependency ratio. The old age dependency ratio ranged from between 0.07 and 0.09. The sum of the dependency youth ratio and the old age dependency ratio represents the total dependency ratio, which ranged between 0.63 and 0.78 from 1950 to 1980. Infant mortality rate. Total of 12.2 deaths per 1,000 live births. Male, 12.4 deaths per 1,000 live births. Female, 12 deaths per 1,000 live births. The infant mortality rate of China fell from 108.35 deaths per 1,000 live births in 1966 to 10.54 deaths per 1,000 live births in 2015. Health expenditures. 5.5% of GDP. In the past 2 decades, health expenditures in China grew at a rate of 11.6% per year, which is much faster than the growth of the country's economy. Hospital bed density. In 2004, China's hospital bed density amounted to 2.4 beds per 1,000 inhabitants. It is 3.8 beds per 1,000 population. Obesity/HIV rates. Obesity in adults is 6.2%. Children under the age of 5 underweight is 3.4%, and the HIV rates are not known. Obesity in China is a major health concern, with overall rates of obesity below 5% in the country, but greater than 20% 40% in some cities. This is a dramatic change from the times when China experienced famine as a result from ineffective agriculturalization plans such as the Great Leap Forward.